Good morning. This is Dr. Chris Cleveland from the Exercise Science program at Southwest Minnesota State University. I'm putting together this quick orientation video if you're new to campus and are participating in the Exercise Science Fitness Center program. I'm standing in front of Founders Hall, and on the time that you were given, you can park in this lot behind me. That's lot A. As you come into Founders Hall, you can see here will be the Student Center. There's a large sign that says Student Center, and you walk into that first door right there. It's number 320, and there'll be the coffee shop there on the right. And I'll meet you there. All right, sorry for that little blip. So we're walking down to the weight room in the fitness center. On your left will be the cafeteria. So you're going to keep walking. We're going to go to the physical education. It'll be the weight room, the SMSU weight room. You might see a very smart student sitting, maybe doing some homework. All right, we're going to keep walking. There'll be, again, the weight room on your left, some vending machines on your right. You're going to go up the stairs. So we're taking a right. This is known as the physical education building, the Phi-Ed gym, or the volleyball gym, as it's better known. We're going to walk. You will do your training, and then we're going to come over to the Exercise Science, Wellness, and Human Performance office, which is located in PE 217. Just come down the hall. Here you will see the Wellness and Human Performance Center office. That's PE 217. That is where you're going to come and meet your student trainer for your first day of fitness testing. We're going to walk down the hall here. So that's the first part of your fitness testing, where they collect your vital data. Then we're going to come to the lab. So you'll come around the corner. So if you ever get lost, you can see here there's a big brown wall that says Exercise Science. Then you know you're on the right track. The lab is here. This is where you'll do your other fitness assessment data, so your actual exercise data. If you get confused, again, here's the big brown wall. Come down here, you'll see a sign that says the Wellness and Human Performance Center. And then you'll come back here. There's our wonderful students. And you'll come back here to the Wellness and Human Performance Center, again, PE 217. So you should come dressed to exercise, shorts and a t-shirt. They're going to be doing blows and things like that. So you want to be ready to exercise. If you have any questions, please reach out. chris.cleveland@smsu.edu, Chris with a K, K-R-I-S .cleveland@smsu.edu. Thanks. Okay, hang on. Okay, sorry for the little pause. So again, I just wanted to give you a couple updates. When you're in this room, you will be doing things such as a sit and reach, measuring flexibility. You're going to be doing a push-up test, a plank test, a balance assessment right here, which is called the Y balance. And then you're going to be doing a 1 mile walk test called the Rockport. The students will explain everything to you. But as part of your informed consent process, I just wanted to point that out. And I'd like you to read all your materials on the smsu.edu exercise science page that you were sent, and meet me back shortly. I have one more thing to go through with you. All right, I'm back. So we're in the Wellness and Human Performance Center office. This is where you're going to meet your student. They're going to greet you, introduce themselves, and then tell you a little bit about what this fitness assessment is about. Samantha, our graduate assistant, may or may not be here. One of us will be here for sure. Then we're going to come over here to an assessment room. So in the assessment room, your student will go through things with you about your medical history. They're going to talk to you about your goals, and then they're going to collect basic data. So for basic data, they will be doing blood pressures with a blood pressure cuff. They're going to be doing some measuring. So they'll use a tape measure. They're going to measure your waist and your hip, what's called a waist to hip ratio, to explain to you what that is, risk of cardiovascular disease, but they'll explain all that to you. And then they're also going to do skin folds. So we focus a lot on body fat percentage, body composition, versus so much what the scale says. So the skin fold assessment is probably the most invasive thing. They are very good at doing it, and they also know that they can ask you if you are okay with doing the skin folds on your skin, or if you'd like to do it over clothing. They've practiced it both ways. So what they do is they do skin folds, and then they compare that to the body fat composition scale. It's called a bioelectric impedance scale. And then that helps them to know how good of a job they're doing. And then we also really focus on body composition. So if your body fat is lower, that's a better health indicator. So the 7 sites, I want you to make sure that I show you where those 7 sites are. So your 7 skin fold sites are your chest. So they may ask you to pull your shirt up. They're going to pinch right here. I can't do it on myself, but I'll show you where they are. They're going to pinch right here, take a couple measurements. That's the first one. Then they're going to go to your abdomen. So find your belly button, and then they'll go over. And if you're okay lifting your shirt up, and they can do it on your skin. If not, they know how to do it over the shirt. Then they're going to do one right here, right about there. Nice. They're going to do your thigh. They're going to do one right here. It's called mid-axillary. They'll do one back here on your shoulder blade, and they'll do one on the back of your arm. So like I said, that's probably the most invasive. So if you have a t-shirt and shorts on, that'd be great to get. Of course, blood pressure is easier for them to do on skin. These skin folds are easier to do on skin, but they do over the clothing for your hip one. And then you always have the right to tell them. Like I said, they've practiced. They know it's more accurate over or on skin, but they know how to do it over clothing. So again, please reach out if you have any questions. I'm sorry about this beta version of this video, but we just moved, and so we had to redo videos, which we're getting there. So reach out if you have any questions. Thanks.